The following program is brought to you in part by Logisticare, the nation's leading provider of specialized transportation network management to state and local government clients. By Maine's credit unions, now is the time for a credit union. There is one for you. And by MacPage, developing relationships, earning trust, addressing complex issues, and making a difference.
Welcome to Pingree and Katz, the main event. In our left corner, we have Hannah Pingree, former House Majority Leader and Speaker of the House. In our right corner, we have Senator Roger Katz of Augusta, representing District 24. This week, Roger and Hannah have assembled a panel of experts to discuss tough Maine issues affecting the entire state. To wrap it up, we'll visit with Gary Crocker as he gives us his view from West Gardner. It's all right here with Pingree and Katz, the main event.
Roger, Medicaid expansion makes sense, covering 70,000 people at the expense of the federal government. How can Maine say no?
Hannah, most of my colleagues think we just can't afford it here in Maine.
Well, welcome to the main event. Roger and I are already going on what is a lively debate happening as we speak in the State House. But I think, as Roger can probably tell you, there might be a middle ground on an issue like this, and that's one of the things we're going to talk about today. Roger?
There may be, but most of my colleagues think that we already insure about a third of our population with Maine Care. It's already eating up about 25% of our budget, and we just can't afford it anymore. And you know what? That position has merit, doesn't it?
Yeah. Everything should be on the table, but certainly with this issue, we're talking about 70,000 adults who make between $10,000 and $30,000 a year, who can't afford insurance otherwise. And really the question on the table is, will we take $600 million from the federal government over the next 3 years to pay for the insurance of these people? A huge boost to our economy, a huge boost to our healthcare system, and something that will lower the rates for businesses and those paying for private insurance. So,
but again, Hannah, in my party, most people think, look, it's already eating up 25% of the budget. It's just growing and growing. It's crowding out our ability to be able to fund the other important things you and I would agree on, like public education, and we just can't really do it. But we'll sort it out with our guests. And if we can't, Gary Crocker will solve it for us at the end.
Excellent.
We'll be right back.
At MacPage, we believe in developing relationships, earning trust, addressing complex issues, and making a difference. We enjoy the people we serve and care about the work we do, providing integrated accounting, consulting, and tax services to our clients throughout New England and across the country. Please visit us at macpage.com to learn more.
The trend is clear. More Maine people are joining credit unions. The reasons are clear. Credit unions offer something different from banks: true financial value, loan rates that are usually lower, products and services with low fees or none at all. That's because credit unions are owned by their members, people just like you, who create a community that welcomes you wherever you are in life. Discover why a credit union is your best financial choice. Now is the time.
Welcome back. We are here with our guests. I'm going to introduce my side of the panel. First, we have Representative Drew Gattin, a Democrat from Westbrook. He's a healthcare project manager as well as a member of the legislature's Health and Human Services. So welcome, Drew.
Thank you.
I'm also joined by Lois Skilling, who is a nurse and now the CEO of Midcoast Health Systems. And it's a pleasure to have you.
Thank you. And to make the case against Medicaid expansion, we have the Republican leader in the Maine House of Representatives, Ken Fredette from Newport, and also Joel Allenbaugh with the Maine Heritage Policy Center, who's also an insurance broker. Gentlemen, thanks for being here. Thanks. Hannah?
Great. Well, I get the first question. I'm going to ask my side of the panel to talk about the broad overview. So, Drew, you are in the trenches. Tell us, what specifically does this Medicaid expansion mean? Who will benefit, and how is it connected to the Affordable Care Act?
Sure, Hannah, thank you. So the goal of one of the many goals of the Affordable Care Act is to lessen the number of uninsured people in the United States, and the Medicaid expansion piece is a critical part of that. So as under Medicaid, while under normal Medicaid, the federal government only pays a portion of the costs, under Medicaid expansion, the federal government for a period of time is willing to pick up 100% of the costs for people who are newly eligible, people who haven't been eligible in the past. So here in Maine, that means we have an opportunity here to provide healthcare coverage for 70,000 people, whereas in other scenarios, we might have to pick up a portion of that cost for the first 3 years. The federal government will pick up 100% of the tab.
Great. And who are those people?
Those people are primarily low-income people. Well, they're all low-income people under 138% of the federal poverty level, which means that they have incomes, under $15,000 a year, roughly around $15,000 a year and less.
Great. Lois, obviously a lot of the debate around this is around the economic benefits to the state. You employ over 1,700 people, a huge healthcare system. What will this mean for Maine's economy, whether we decide to expand Medicaid or if Maine decides to turn down these funds?
Well, today, Hannah, in our current health system, there's a lot of cost shifting. These people that Drew was just talking about, the 70,000 Mainers who today don't have access to health insurance, are still receiving health care. And that really adds up to free care and bad debt that Maine hospitals are shouldering the burden, which then gets shifted to individuals and employers who are paying for health insurance at a higher premium. Maine, as you know, has higher health care costs than other states in the country, and hospitals in Maine feel that this boost from the federal government reimbursing for their share of Maine care will be an addition to Maine's economy.
Great.
All right, and now for the rest of the story. Representative Fredette, most people in our party believe that Maine just can't afford this to take on another 70,000 or more people. Could you expand on that?
Well, essentially, we already cover about a quarter of our population by adding another 70,000 people. We're looking at expanding to essentially a third of our population. We simply can't afford that. We fought in the last session to pay our hospitals $500 million. In the 125th, it was another $250 million that we owed to Maine hospitals. That's $750 million that Republicans paid back to the hospitals. That's gone on for a decade now. Budget overruns in terms of the hospitals and the Medicaid expansion program that they employed back in 2002. So what we're looking at is really trying to be fiscally responsible and do it in a way that's good for the Maine taxpayers.
And apart from the financial issues, Joel, there's a feeling among many that the more people we put on this program, the more we're contributing to what's called the culture of dependency in our state. Do you agree with that? And how does expansion further that?
I do agree with that, and when you look at where the numbers come from, we heard about the uninsured coming onto the program through the expansion, but if you look at the expansion in 2002, it wasn't just the uninsured. In fact, the uninsured rate barely budged. What happened was people who bought private insurance previously, either independently or through their employers, were largely the ones who shifted over to Medicaid. And you literally had people making an economic decision. Where can I get the best deal? And if we continue to do that and continue to move people from private coverage over to Medicaid, that cost shift that you hear about really exacerbates private health insurance premiums, which is a huge economic impact to the business community here in Maine.
And you sell insurance for a living, is that right?
I do, and I work with businesses every day, and their struggle with all of the provisions of the Affordable Care Act, but specifically the premiums. The premiums have been going up double digits on average for decades here.
Thanks. Hannah?
Well, I'm going to kick it off with Drew and let you kind of respond a little bit to the other side, but let's talk about the specifics of the kind of people who expansion will cover. I mean, these are people who are making between $10,000 and for a family it would be about $30,000 a year. A lot of them are working families, working adults. So what does that mean? I mean, are we talking about people who could afford private insurance?
Well, no. I mean, first of all, I mean, if we don't expand, the people at the very lowest ends will not have access to any insurance at all. And for the people on the higher end of even that low scale of $15,000 a year, are going to be subject to premiums and copays that they can't afford. The goal of getting people insured. the goal of giving people insurance or letting people have access to doctors and medicine is to keep them working. These are working people primarily who really can't afford to get sick. They're struggling now to pay their bills and buy heat and buy groceries. A lot of them are people with chronic diseases like diabetes and heart disease and Crohn's disease. They need access to medicine so they can continue to be productive and bring themselves out of poverty. It doesn't put people in dependency. It helps people to get people out of dependency.
Great. Lois, tell us from a healthcare perspective, a patient comes in with a kind of coverage like Medicaid or an uninsured person. What is the difference in the kind of treatment that they will receive, the kind of, follow-up, preventative care? Tell us, what does Medicaid mean for a family or individual?
Well, first, all of Maine's hospitals are nonprofit charitable organizations, so regardless of a patient's ability to pay, they receive care. But what happens when people lack insurance is they don't go to their doctor, they don't go to the hospital until it's the last resort. Therefore, preventative care or things that could be taken care of earlier or more regularly to keep them healthy, that goes undone. So the goal of access to health care is to improve the health of the population so people actually become healthier so that the overall cost of the healthcare system can go down.
Great.
Ken, we've got about a minute left in this segment, but there are those who've pointed out that, look, in other states, some Republican governors have actually advocated for expansion within their states. Yet here in Maine, Republican Party is pretty much against it. Are there things which are unique to Maine, which means that we shouldn't particularly be doing it here?
Yeah, I think fundamentally it's the expansion that we did back in the early 2000s, where we already expanded and covered already so many people in Maine, which actually hurt us. When the ACA was passed, we actually ended up getting a lower reimbursement rates for some of our people that were covered under the lower expansion. I think what the important issue here is that the exchange that's available allows for people to buy insurance at very cheap rates through the exchange.
Okay, we'll come back to that after the break. We're going to take a break right now, and we'll come back and revisit this issue. But Hannah gets to cross-examine my folks, and I'll do the same. We'll be right back.
Now is the time. If you're ready for a home loan or a home repair, if you want to get behind the wheel of a new vehicle, make it happen with a visit to your local Maine credit union. For low loan rates, great terms, and decisions made locally. Everything feels right about a credit union, starting with people who are always willing to work with you. If you want a better way to borrow, join a Maine credit union, your best financial choice. Now is the time.
At MacPage, we believe in developing relationships, earning trust, addressing complex issues, and making a difference. We enjoy the people we serve and care about the work we do, providing integrated accounting, consulting, and tax services to our clients throughout New England and across the country. Please visit us at macpage.com to learn more.
And welcome back to Pingree and Katz, the main event. We're talking about Medicaid expansion. Hannah, you're on.
Great. Well, we let Ken have the last word last time, so I'm going to start off with Joel. And Joel, you obviously work with businesses across the state. One of the fears that is if Maine doesn't take this Medicaid expansion money, it's hundreds of millions of dollars a year, it means that there will be cost shifting to businesses and people who are private pay, people at hospitals and healthcare providers. Maine is among the only states so far in New England and almost all the way down to Washington, D.C. that has not expanded Medicaid. So how do you combat that? I mean, the Maine Chamber of Commerce is on board. What's the business argument against this?
There's a couple, and one is that the business community, when an individual goes into Medicaid, for example, and the expansion is up to 138% of the federal poverty limit, as we heard, people can go to these exchanges and get private health care coverage from 100 to 138% of the poverty level. And I've run quotes on those. They're very heavily subsidized by the feds. And in fact, if people are on private coverage versus Medicaid, the reimbursements to the providers are going to be more significant. And I think it actually pushes the cost shift in the other direction. The other issue is that the cost of Medicaid expansion and the predictions of what that cost will be are based on enrollment numbers. And a lot of the business community right now is struggling with the ACA in general. We don't know how many will continue offering coverage, how many employees will be moved to part-time status. We don't really know what the overall impact will be of who becomes eligible. And if that creates a bigger tax burden for the business community, then that becomes another issue for them to deal with.
Ken, so tell me a little bit. I know actually my good friend Senator Katz has proposed a compromise in which Medicaid would move to a managed care model, and the whole goal would be to better manage the cost of the Medicaid program, which you have raised concerns over. Tell me some of your concerns with his compromise. Obviously, that compromise also would sunset the program after 3 years. Talk about your concerns with the compromise.
Well, I think fundamentally at the most basic level, what we're really not trusting of is the fact that even if his bill was passed into law, we think, quite frankly, that if there were an election and Mishu were to be elected governor, we think, quite frankly, the Democrats would move very aggressively to scrap all of those pieces in there that would have any sort of Republican fingerprints on it. And so we're really looking at, what is the bill? What can we really afford? We stopped this in the first year of the 126. I think we're going to stop it now, and I think we really need to look at, the exchanges. That's the untold story here, where people that are low-income people can go in for as low as $5 or $10 a month, buy insurance. Hospitals get higher reimbursement rates. People will go in and use those services less because they're going to have a little skin in the game. The exchanges are really the untold story here that I think are the salvation for helping the low-income Mainers.
Did I just hear you say Obamacare is the salvation for the low-income Mainers?
What I said is I think the exchanges, which are a federal law, are a piece of the pie, just like Medicaid Part D that it provided for prescription services for the elderly. This is a federal program. This can be on the federal government, not on Maine taxpayers.
Maybe we're making some progress. Great.
Well, let me pick up where we just left off with Representative Fredette, Ms. Gillings. Aren't they right? I mean, many of these folks are between 100% and 138% of the poverty level, and they would be eligible for significant subsidy premiums on the exchange, 100% paid for by the federal government going forward, not just for 3 years. Isn't that the better deal? That's what he's really suggesting.
I don't think so. I think that it's time for us to move ahead and accept this federal money that can come into our state to help provide an economic boon to help lower overall health care costs. I think on a macro level, eventually, I really hope that our colleagues are right, that all of this together, the Affordable Care Act has so many complex pieces, but at the same time, it was designed to all work together. So expanding Maine Care is a big part of what makes the exchanges work.
Thank you. Representative Katine, you spend a lot of your time, as do I, dealing with other issues besides just healthcare issues. Sure. And I know we're all troubled by the fact that the Medicaid program is taking up over 25% of our general fund budget, headed toward 30%. It's crowding out our ability to fund public education, higher education, roads and bridges, all the rest. Isn't that a concern? And aren't the Republicans right when they say, look, it'd be wonderful to give additional health care to people, but we've got to save some of our money for these other equally important priorities?
Well, again, we need to manage our Medicaid program better. I think that's something that we can all agree on. The fact of the matter is the Medicaid growth has been very flat over the last few years. Enrollment is down. I think, and actually this year, the federal participation in the general Medicaid program is going to go up. So I think what we've seen over the last few years across our economy is rising healthcare costs. But in our Medicaid program over the last several years, we're seeing that flatten out and enrollment is coming down. I would like to really quickly address the issue about the exchanges, though. If the Republican solution here is to let people go to the exchange, that leaves the poorest of the poor out in the cold, because people under 100% of poverty cannot go to the exchange and get their insurance there, because the ACA was designed for around the whole concept of Medicaid expansion as the solution for the people who are really the low-income people.
Sure, but why isn't that the solution to that with Congress, and why haven't they done anything about it yet?
Well, I mean, I think as Hannah alluded to, it's really great to be in this room and hear Republicans now embracing the ACA. If people think that they can go to Congress and get this fixed with the politics as they are down in Washington, which we know are very problematic and dysfunctional, I guess that's an avenue we can explore. But right now we have an opportunity, and it's time limited for 3 years. We're already missing out on the first couple months of that 3 years of having 70,000 Mainers come and have access to doctors and medicine, and have the federal government pay for 100% of that.
Thank you. Yeah.
Great. I'm just going to actually give Joel a little opportunity to respond to that. I mean, we started on that argument, and you talked about how you had been seeing some people coming in asking for quotes. But I think of the reality, a family of four who would qualify under this, makes $32,000 a year or less. I mean, that is not a lot of money if you're paying rent and paying your heat and everything else. I mean, what is the option for a very low-income family or a moderate-income family that literally, they don't have more money, whereas this Medicaid expansion would allow health care coverage for those parents?
Well, you have to first remember that everyone has access to health care. We're talking about health insurance right now. We're talking about how it gets paid for. I've seen quotes literally through the exchanges for people in those lower income brackets at zero premium. I've seen them at less than $5 a month for family coverage. So they are very, very significant for that population. And I'd have to agree, if it's the population under 100% of the federal poverty limit that is left out, that needs a solution, we should address that solution strategically and surgically, not expand broadly at a financial consequence and impact to the state.
Great.
We've got one time for one more question, I think, and let me ask either of you who choose to answer this. We're talking about millions of dollars that could come into the state of Maine from this expansion, but we're talking about a federal government with a $14 trillion deficit. We're deficit spending. How can we expect this to continue? And aren't we really just passing the problem on to our grandparents? How responsible is it to even take this money in the first place?
Well, I mean, if you go back and look historically, going back to the beginnings of the Medicaid program, the federal government has never, ever welched on any of its commitments to us. There have been periods of time when they've given us more money. The formula for which the match rate is determined has remained consistent, and I don't think there's anything that would indicate that they're not going to keep their commitments here, especially for this 3-year period, at 100%.
So we keep adding and adding to our federal deficit, don't we?
Well, I think there is no question in any healthcare leader's mind today that it's our generation's job to fix healthcare. We need to fix healthcare to be less expensive and so that we can deliver better outcomes of a healthier population. It is the best feeling of the best thinkers today in our state that accepting this Maine Care money will help us to launch that and continue that goal toward what's called the triple aim, lowering healthcare costs so there is more money for our students and our colleges and our roads to be fixed, while at the same time improving access to care and keeping our people healthier.
Well, thank you very much, and thanks to all our guests for just a terrific discussion. Hannah and I will be back in a moment to sort it all out.
At MacPage, we believe in developing relationships, earning trust, addressing complex issues, and making a difference. We enjoy the people we serve and care about the work we do, providing integrated accounting, consulting, and tax services to our clients throughout New England and across the country. Please visit us at macpage.com to learn more.
The trend is clear. More Maine people are joining credit unions. The reasons are clear. Credit unions offer something different from banks: true financial value, loan rates that are usually lower, products and services with low fees or none at all. That's because credit unions are owned by their members, people just like you, who create a community that welcomes you wherever you are in life. Discover why a credit union is your best financial choice. Now is the time.
So welcome back. Medicaid expansion. What do you think?
Well, I thought that was a great panel. I think both sides made strong arguments. Obviously, I agree with the folks saying that this is going to be good for Maine's economy, good for patients, good for low-income people that can't afford insurance. I thought it was interesting, actually, the Republican leader and Joel both talking about how the Affordable Care Act actually is going to offer insurance to low-income people as well. So I actually took that as a step in the right direction, but I still question whether that's the right solution.
Well, the Affordable Care Act is the law of the land, but the Republican approach to this, Hannah, is that, look, it would be great to provide insurance to tens of thousands of more people. We just can't afford it. We already cover a higher percentage of our population than almost any other state. This would just add to that. The federal government's promises in the past haven't really been worth much. And why should we be adding to the federal deficit, particularly when many of these folks could go on the exchange? So it's a real philosophical divide here. Maybe there'll be some room for middle ground, maybe there won't. But it is the defining issue of the session.
Well, the question is, can we afford not to? But you'll help us decide a solution to that in the next couple of weeks, and I wish you luck on everything you're working on. And we're going to go to Gary Crocker, who is going to talk about his family's very unique solutions to their healthcare challenges that we don't recommend to any of you at home.
Well, I recently visited my local health care provider, and her name is Aunt Mehitabel. And she's been my family's source of health care since I was a mere child. Although her credentials don't allow her to actually charge for her services, her medical advice has always provided our family with the best possible guidance. Unless, of course, you'll consider the time when she told my Uncle Wilbur he could do his own blood test with his son's chemistry set, or when she told my cousin Freddie to rub some dirt on it and walk it off after he broke his leg in a nasty fall from his roof, and his axe, which he'd been using to clear ice from the gutters, landed on his hand and broke 3 fingers. And then there was a time she told my grandmother to, come to think of it, the fact that Aunt Mehitabel once changed the oil in her doctor's car wasn't the kind of professional preparation you like to see in your healthcare provider. I'll get back to you on this one. Yeah?
Well, you never know what Gary's going to say, but I just want to thank you again for watching.
And remind me never to go to see his aunt for anything other than changing the oil.
Absolutely.
Thanks for watching Pingree and Katz, the Maine event. Join us next time when we'll talk about charter schools. See you then.
This program has been brought to you by Logisticare, the nation's leading provider of specialized transportation network management to state and local government clients. By Maine's credit unions, now is the time for a credit union. There is one for you. And by MacPage, developing relationships, earning trust, addressing complex issues, and making a difference.